My name's Farhana. I work for Ashford and St Peter's Hospital. I'm currently the quality team administrator, and I'm also the shorts round coordinator for the trust. And I've been working at the trust for actually nearly 5 years. I work in a team ranges from senior managers to mid-grade managers and kind of administrative staff. So we have about 30 to 40 people in our office. So they could range from like the quality risk manager, the chief of patient safety, the director of quality, and we have a claims and coroners support, patient experience, so all types of people, all types of disciplines. I think that support and that motivation that your colleagues give, that relationship, because we spend most of our time with our work colleagues. I actually find I spend more time with my work colleagues than family, and I think it's so important to build that relationship, and that kind of makes the days go smoother, and they've always got your support and your best interests, and I think it's about showing that kindness and that understanding, and that really helps me to have a good day. When hierarchies get in the way of compassion, so it's, say if you are, I think it's gathering that understanding from others, and I think if you let egos or the hierarchy get in between that understanding, you know, there's no compassion in hierarchy or egos. So I think that days like that, when I've not been shown compassion or understanding in what I'm trying to say, what I'm trying to achieve, that's been quite frustrating for me. Just that gets in the way of things. For me, it would be to really make a difference in healthcare, and especially in my team. I would just want to look at different ways of communicating, because we have staff at all levels and not everyone communicates the same. So it's kind of just expanding the horizon and just looking at different, maybe innovative ways of communicating, not just with our team, but the trust. So an example of that is I'm part of a Twitter group, which consists of doctors, nurses, physios, administrative staff, volunteers. Anyone can be involved, communications team. And that we just have a group on Twitter which we just discuss ideas, innovation, themes, what we can roll out in the trust, and it's a very informal conversation. All hours of the night we're on Twitter and we're actually connecting with our colleagues. So I'm sometimes up at like 11 o'clock at night and I'm like, what am I doing? Technically I'm at work, even in my bed. So it just breaks down those barriers, and it paves the way for easy informal communication. You have that informality, it really it allows for people to be open up and be comfortable, and that's so important to, you know, for people to be creative and innovative when you give them that space to do so.
So you would try and find different ways for people to
connect with each other, yes.
Kind of across the hierarchy, or
across the hierarchy, yeah, just to break down some of the barriers and maybe egos, and our Twitter group's absolutely fantastic. It's called #ChangeTheWorld. And so we have all sorts of ideas going on there, and then we all work as a team, and you know, we've got ideas flying out on the weekends, at night time. So it's a really nice safe place for us to connect with each other. And it's actually going above and beyond, because nobody really works weekends if you don't have to, or in the evenings.